there's so much shame of it. And it's like, well, just come and talk to us because there's so many instances where I've had women come in to see me for that reason in particular. And then while I have these things called pessaries, which I say are like little bras for the vagina, you put it in and it lifts everything to where it's supposed to be because a lot of that urinary incontinence is because things have fallen because of that nerve injury or tissue injury from the bladder, from the vaginal delivery. So if I give you a little bra for the vagina, you stick it up there, all that misery that you're experiencing, for months or years beforehand, I fixed it in like 10 minutes. And now you don't have to leak ever again. And you don't even know that it's there because the goal of a good pessary is one that you don't feel. So usually I will do a fitting in my office and I'll say, come in, they're crying, they're hysterical, because they're so embarrassed by it. And I'm like, I'll be right back. I don't even tell them what I'm going to do. And I come back and I'll have a little basket. And I'm like, look at all these things that I have for you. And the reaction is like the same, like all of us women wear the exact same. We have the same reaction for everything. They freak out, they don't know what it is. And they're like, you're not putting that in me. And then I give it to them. You can feel it. It's made of medical grade silicone. It's not going to increase your risk of infection. It's not going to cause you any harm. And then I say, okay, let me just try this. We place one in, and then I say, walk around. All those things that would make you leak, like if you cough, or you laugh, or you jump, do all of those things here. And if you don't leak, you're good to go. And then I will go. And it's like, in 10 minutes, I solved your problem. But that would have never happened if you don't come and tell me. So you don't have to suffer in silence, because a lot of these things are fixable, and there's such easy fixes, and you don't have to have surgery. And a pessary is so cheap, it's like 10, 15 bucks. So, yeah.
So, Dr. Scott, she has her clinic that is going to be opening August 10th, August 9th?
No, June 2nd.
June 2nd?
June 2nd.
June 2nd, June 2nd. So she is located in Fort Wayne, but as I know, many people that will travel to see their doctors. And, once you get established with her, at one time, you can always go back, as just like a telehealth appointment. So it's definitely something where you'll be able to really connect with her. I know she's a great physician. Now, we're going to transition into menopause a little bit because that's like a big deal now. Even if it's so sad that so many women have been dealing with menopause for so many years, and it has been a topic that people are not talking about. But specifically Black women, we suffer with worse symptoms, and it lasts much longer. And what's so cool about Dr. Scott is that she actually is a menopause certified provider. So as an OBGYN, you can go get additional training in menopause. So she's gonna, I just want you to sort of know a little bit about it, some of the myths that are associated with menopause, how women should feel, how early can someone, how women go to menopause. Some women feel like, oh, menopause is over, but really it's a state that you'll always be in once you hit that. And sometimes women start extremely early. They don't know about that perimenopause, and they're having heart palpitations, or they're having, these hot sweats, and they're like, oh, what's going on? They don't realize that every cell of the body is affected by this hormonal hormone that you're talking about. So let's just sort of talk about menopause, and then move on to our Q&A.
Okay, so yes, women will spend 40% of their lifetime in menopause. And so for us to experience that much time in that state where we don't have estrogen, you would think that this is something that residency programs are teaching their trainees, and they're not. So it was me really being educated by a lot of my patients, because they would come in and they would complain about all this stuff, and I would be like, that's not menopause. I've never heard of that. But just because I didn't know didn't mean that it wasn't happening to all these women. So I made a point to that tissue has shrunk so much and they don't have any elasticity in it because they've lost that estrogen. So a lot of women, I think that there was a lot of hesitancy in talking about these things because they were getting dismissed by their providers who were like me, were ignorant, had no idea what to do, how to treat it. But now that I know, even if patients aren't coming to me to ask anything about it, I'm asking them. So in my office, you got to fill out a questionnaire. So even if you feel embarrassed to bring it up, you're not going to be embarrassed to write it down, hopefully. So I can bring it up, and I can bring it up in a format that will be able to provide you some solutions. And hormone therapy is a great solution for that. I know hormone therapy gets a bad rap because a lot of people think it causes cancer, breast cancer in particular, and there's so much evidence to prove that that's not true. Estrogen is very safe, if prescribed by a doctor who knows what they're doing. So estrogen and progesterone are like the mainstays of therapy that we do, but then there are other things that are like antidepressants that can help with hot flashes. So if you have some reservations and you don't want to do hormones, then there are other alternatives that women can try. And then there's some natural things that you can do also. And so part of my practice is we do aesthetics also. So for those women who maybe have some vaginal issues and they, for whatever reason, are still nervous just are warmer. And then get a cooling blanket or get like a satin pillowcase that might be a little bit more cooling or something like that. So it doesn't have to be that there is something medically wrong, but absolutely if those are things that you're experiencing, it is definitely worth an evaluation to just rule out that it's not going to cause.
Can you talk a little bit louder? I got a question about fibroids. Fibroids. Okay, what makes them grow and why do you get those?
Okay, so that is a very hard question to answer without like going into a whole lecture. But they grow, it's a tumor. So anytime cells are rapidly dividing, then you can have an error in those cells. And so that's the start of it. But then we have hormonal factors that will contribute to that. We have diet factors that will contribute to it. Toxins that are in the environment that will contribute to it. Stress. So African Americans, we experience a lot more stressors in our life because we have a lot of biases and things that we have to deal with on a regular basis. So all of this has been very well studied to determine that it's a multifactorial problem in terms of how they grow. But a lot of it can be controlled. So when a lot of women say they will just treat their fibroids with their diet, that's not true. You can prevent their growth, but you can't make it go away. So once it's there, you have to recognize, okay, this is a problem that I have. While it's small, if it's not growing, there's nothing to do. But the second it starts to grow, then we need to do something about it. So a lot of times, I advocate for birth control, even if people aren't trying to get pregnant. I mean, even if you're done having kids, because we're trying to suppress those hormones to keep them from stimulating the growth of that fibroid until you're ready to do something more invasive to fix it. But healthy diet is a great way to, when it's small, to fix it, to keep it from getting to be a bigger problem.
I got a question.
Wait, I can't hear you, I'm sorry. You don't have to. Correct. This is when I will do a hysterectomy. If you're having severe symptoms, so you're bleeding to the point where I'm giving you blood transfusions, or your pain is so severe you can't get it under control. And if your uterus is if that fibroid is like 10 centimeters or more, I would do a hysterectomy because there are other procedures called a myomectomy where we can just carve out that fibroid and close that tissue back up. And also, some of this depends on where in the uterus is the fibroid, because that also will dictate, how aggressive it should be. But for a lot of women, if the fibroid is in that muscle and it's occupying almost all of the anatomy, then once I try to take that fibroid out, I've distorted the anatomy so much, I've exposed so many blood vessels that if I try to sew it back up, you don't have much tissue left, and now it causes more harm than good. So in that instance, I would just take the uterus out. But if they're smaller than that, you don't have to. You can just take the fibroid out. You can treat the fibroid like I was mentioned with that other procedure. You can do medication, and you can keep your uterus.
Hi, I have a question about menopause. So is it possible to hit menopause before the age of 50?
Is it possible to hit it when?
Before the age of 51.
Absolutely. So that menopausal transition, we say on average it's age 51, but that's just, the average. You can hit it any time before then. So usually I would say between 45 and 54, that's like that menopausal transition when a lot of women will start to either go through those changes or finish it and officially be in menopause.
Can you get fibroids while you're pregnant?
Yes, well, a lot of times you might have it before you were pregnant, and we didn't know it because we weren't doing ultrasounds just because, but now that you're pregnant, we see the fibroids therapy. But if they do grow, then we have to take into account where is the fibroid in your uterus, and is it going to be blocking the passage to keep the baby from coming out? Because if that's the case, you got to have C-section. And if you do a C-section, you never want to take the fibroid out at that time. You want to wait and do it once your uterus is healed from having the baby, then go in and take the fibroid out.
Does fibroids make you gain weight?
So the fibroid itself doesn't make you gain weight, but it can give the appearance that you gain weight if it's really big. So your uterus is supposed to be like less than the size of your fist, right? But sometimes for women, that fibroid is grown so much, it's all the way up to their sternum or their belly button. So then it looks like you gained a bunch of weight. Sometimes you can look like you're 30 weeks pregnant, and it's just a fibroid. So it's not making you gain weight, it's the mass that is getting bigger.
I have a question for the menopause. If you have menopause, does it cause you to like have extreme pain in that area? But my cousin, she's older and she's been going through it. Like over the weekend, she was just saying that she's having a lot of pain, a lot of different changes, and she's just trying to go with it.
Okay, so does menopause cause pain? Okay. Not necessarily. So remember how I was saying like your pain perception can change when you lose estrogen? So in that sense, you might experience pain a little differently. But you can have like bone resorption or your bones are breaking down and that leads to osteoporosis. That can be uncomfortable and that can cause pain. So it's not just the going through menopause that's doing it, it's the changes that are happening with the body that is causing the pain. So bone density scans are things that we also want to make sure we're doing as you're going through menopause because the bones will get weaker. So estrogen will help to strengthen those bones, to make them stronger again. And it's not good, that's probably the one thing that we don't experience as much as other patient populations is like osteoporosis. We still can have it, but we just don't have it as much as other people. But that's probably like the biggest source of pain. Or joint pain. Because we lose that estrogen, it can cause some joint pain.
Doctor, I was wondering if therapy does it have to be referred by a doctor? The therapy that you're talking about, that progressive therapy, does it have to be referred by a doctor? Is it covered by insurance?
Good question. It can be covered by your insurance depending on the indication as to why you're getting it done. But I feel like for the most part, insurance companies will cover it.
So, need a referral? Go ahead.
Okay, I have a question. So I had cysts and fibroid. So how does that affect pregnancy?
So, cyst on your ovaries, only if it's getting bigger and it's causing you pain would it affect you. But it's not going to impact the baby's growth. It's not going to impact how the baby's developing. The fibroid won't either, but they can cause pain. So we would just have to figure out a way to manage that pain. And the other thing is knowing where the fibroid is to make sure it's not in that outlet of where the baby is going to come through. So it's not so big, it's keeping you from being able to deliver vaginally if that's what you want to do.
Do you have any recommendations or suggestions, medication-wise, as far as menopause or myself or severe menopause?
I'm so sorry, I can't hear you.
Medication for hot flashes.
Vioza?
Okay, so Vioza is great, but so usually my algorithms for getting patients up for hot flashes would be one, what is a contraindication or reason why you can't do hormone therapy? Because that's the best. So if you really want to tackle the problem, go for the best thing, which would be the estrogen and progesterone therapy. But let's say you're a smoker or you have a history of some kind of cardiovascular disease and it's not safe for you, then so they can help you to transition through that phase. Because the whole point of this is to give you a better quality of life.
She did have a question. How does menopause have an effect on mental health? If you could just answer that one.
Yes. Okay, so a lot of women going through menopause, one will experience more brain fog. It doesn't mean that you lost your memory at all, but it's just like you're slower to remember things. And that's not a forever process, but it's something that a lot of women get. They're not in their head, they're like, yep, I've done that. But it can lead, a lot of women will also experience depression. It doesn't mean that menopause caused the depression, but a lot of the working theories are the symptoms that you're experiencing. Because when you're having hot flashes, you're not getting good sleep. If you're not getting good sleep, you're tired, you're frustrated. That's impacting your weight, it's impacting how you're interacting with your family, and that's what's leading to the depression. So it's not the menopause itself, it is all the other symptoms that are coming along with the menopause that can contribute to the depression. And if you already have a history of depression, then it'll be heightened because of those things.
Well, we want to say thank you so much for Dr. Scott being here.